Lateral ankle sprain physical therapy protocol. The lateral ligaments of an ankle are most likely to be damaged in sprained ankles. A complete rehabilitation program for lateral ankle sprains can mean the difference between a fully healed ankle and a more serious sprain down the road. Chronic lateral ankle pain can develop after a sprain as well. One of the most effective ways to treat a lateral ankle sprain is hydrotherapy. Check out the hydrotherapy exercises below to learn the best tips and exercises for treating a lateral ankle sprain. Extremely effective hydrotherapy exercises for treating common injuries. Part 1. Lateral ankle sprain sample progression. Always consult a medical healthcare professional before performing any of the following interventions. 1. GAIT training in the hydrotherapy pool. One of the first priorities following an ankle sprain is achieving a normal gait. By putting an individual in the pool, the water makes it possible to walk much earlier in the acute injury stage than walking on land. Water's buoyancy and anti-gravity properties create an effective environment for partial weight-bearing exercises. First of all, hydrostatic pressure helps decrease swelling. Secondly, GAIT training in a pool eliminates the need for crutches or other assisted devices. Without these devices, the injured individual can achieve a regular gait and the involved muscles will fire naturally. Hydrotherapy exercise. Simply walk back and forth in the pool. 2. Single leg balance on the injured leg while playing catch. Activating proprioceptive neuromuscular receptors is extremely important in the early stages following an ankle sprain. Using a balance exercise with an outside force of catching a ball is a simple yet effective way to achieve this activation. Water not only provides a safe environment, helping to remain in balance, its contact with the individual's skin activates many proprioceptive receptors. Hydrotherapy exercise. Stand on one leg and toss a ball with someone outside the pool. 3. Double leg line hops. Introducing a low-level plyometric midway through the rehab process is a common and recommended practice when treating a sprain. Working in the water makes it possible to initiate this exercise sooner than it would be possible on land. In addition, the water's resistance helps maintain and/or build strength in the muscle surrounding the ankle with limited stress to the joint itself. Hydrotherapy exercise. Hop with 2 feet back and forth over a line in the pool. Land on your toes and jump quickly as soon as you land. 4. Underwater running. Running is important to help maintain fitness levels and sustain cardiovascular endurance. Running in the water is extremely beneficial because an individual can do this during the rehab progression. There are a number of techniques to use to run in the pool. Read about 5 easy methods to use. An individual can run in the water during the rehab process long before they can run on land. Running in the water can lead to running on land much sooner. Hydrotherapy exercise. Run in the water. 5. Side-to-side alternate leg bounce. High-level plyometric exercises should be introduced before an individual returns to sports and an active lifestyle. This explosive exercise will fire fast twitch muscles to improve an individual's strength, power, and balance. Introducing these in water is the perfect way to progress them from the pool to land-based rehab. Hydrotherapy exercise. Stand on one leg and bound laterally onto the other leg. Once you land, jump quickly and powerfully back to the other leg. If you have a sprained ankle and you don't rehab it properly, statistics say that you will suffer another more serious sprain within 12 months of your first injury. These statistics are based on hospital emergency room visits for the same injury. For years nobody has been able to explain why this is, but a recent study by 2 major universities have found the answer. When you injured your ankle, the damage that occurred was more than just to the ligaments and tendons in your ankle. Damage also occurred in the electrical system that tells your brain what position your foot is in. For years many doctors have known that only a 1/16 of an inch change in height in a walking surface can result in a person tripping, so is it unreasonable to think that damage to position sensors in your foot could cause you additional injury if they are not rehabilitated properly. The traditional approach to rehabilitation by most doctors is RICE. But most people don't know that the RICE protocol is actually only an approved first aid response to a sprained ankle and not a rehabilitation method. A proper sprained ankle rehab program will help strengthen the muscles that support the ankle joint, repair and recalibrate the position sensors in the foot, and restore complete range of motion to the ankle. There are many approaches to rehabbing a sprained ankle, but not all of them are complete and address the damage that occurred as a result of the injury. Make sure that any rehab program you follow or are instructed to follow by a doctor or physical therapist includes the following items: strengthens the muscles that support your ankle, restores range of motion the way that you walk. Rubber band therapy will cause you to have sore spots long after you think you have completed rehabilitation of your sprained ankle. Repairs and recalibrates the electrical position sensors in your foot that are known in the medical community as proprioceptors. Helps to gently get rid of scar tissue that can restrict movement and cause ongoing pain and possibly arthritis later in life. Focuses on rehabilitation while bearing your own weight. There are some programs that don't require you to bear your own weight, which gives you a false sense of security that your ankle is healed when it really isn't. Recent advances in rehabilitating sprained ankles have reduced the time to complete recovery from weeks to days, so you should be able to get back to your life faster than ever before. Make sure that you are using the most advanced and aggressive sprained ankle rehab program possible, because nobody wants to sit on the sidelines and watch life pass them by. Oh, one more thing, it's important. Whenever you rehab a sprained ankle, always do the same exercises on the ankle that is not injured, so you don't suffer alternating sprained ankles due to one ankle being stronger than the other. A Google search for sprained ankle rehab will help you find the best programs available today.